Thank you, Alex.
This is Alex, by the way, that does all things amazing for IT and most of our meetings. So he's behind the scenes. You don't actually see him when we have city council meetings, but he's there making it work. So thank you for joining us.
Of course, thank you
With us. And Leila was here, Leila Archuleta, who's our deputy city manager. And she was able to bring the food. So.
And Julie Sanchez had her baby.
Oh, yes. She did?
Oh,
David.
David.
It's called the Community Health and Safety Task Force for October 10th, 2023 to order. We have a roll call. Do you do that?
Yes. Thank you. Welcome, everyone. Roll call.
First off, really, do we need a motion to continue?
I think we have to do a roll call first before we do the motion.
I guess so. Okay, yeah, we can do that.
Okay.
Sure.
Roll call.
Okay. Councilor Cruz Rivera.
Here.
Councilwoman Villarreal.
Present.
Monica O. Present. Mary Louise Romero.
Oh, here.
Mary
Lou? Who's Mary Lou?
Mary Louise Romero. Bruce.
Yes.
Marcela Diaz. Here. Emily Cottonbach.
Here.
Gino Zamora.
Yes.
And Annie Raskin is excused.
Annie's not feeling well, so not going to be able to join us.
Thank you, Valeria. Now I'll entertain a motion to resume our meeting from September 26th.
So move.
I'll second.
We have a motion from Mr. Zamora, a second from Ms. Kaltenbach. Any further discussion? We have a roll call on that, please, Valeria.
Absolutely. Councilwoman Rene Villarreal.
Yes.
Gino Zamora.
Yes.
Emily Cottonbach.
Yes.
Marcela Diaz.
Yes.
Bruce Finger.
Yes.
Mary Louise Romero.
Here, I mean, yes.
Yes. Councilor Chris Rivera.
Yes.
And Monica.
Yes.
Okay.
You have.
Thank you. We are approved to resume our meeting from September 26th. We'll
Okay.
wait for approval of the minutes till, go ahead, do you know what we can say?
I just want to, for the record, note that our meeting, even though it's a continued meeting, has still been noticed in accordance with the Open Meetings Act for us getting together tonight.
Great, thank you. Appreciate that.
We also have 3 guests.
Oh, yes, thank you to our guests. Would you like to introduce yourselves?
I'm Sarah Grant.
Thank you, Ms. Grant.
Ana Martinez, with someone.
And I feel like you've been part of this committee. Same with you, Ms. Grant.
And I'm Evan Chandler with the report.
Thank you for being here. Appreciate it. We'll wait for approval of the minutes until after, since this meeting hasn't concluded yet. Item 2, communications from the co-chairs. Renee?
I think I said everything that I wanted to say the last time. So I'm just happy we can reconvene to complete our work. And yeah, just happy that folks are here with us. And if there's, let me think. There was one thing. Let me think about it and I'll go back to you. There was something I wanted to mention, but.
All right. Since this is our last meeting, I just wanted to thank you all for being here. Renee and I talked about it last time, and even the members that weren't able to continue on. We had a few members that decided to resign for personal reasons, and the judge had to resign for personal reasons. So we had a number of people, but their input, I think early on, I think really helped formulate where we are and where we're going. And it's just such an honor to be with some of the brightest people in this city. I really mean that. So you guys are tremendous, and I've learned a lot from all of you. You've all taught me a lot, and I appreciate that. So thank you very much.
The one thing I was going to mention is I have talked to 2 folks that were part of our group that do want to attend when we present at the council in November. And so just to let them know, we can keep in touch with the folks that were part of our team, because you're right. I think Councilor Rivera made a point that we were talking about, even with times that the few moments that we did have with folks, it was impactful and it did shape the kind of trajectory and work that we're doing here and the importance and then just the importance of getting to know each other and building trust. They said that at the last meeting. I think it's important because it's hard work and I value all of the work and input, and things take time when you want to do it right. So here we are today, and I'm happy that we're getting the final chapter, closing the final chapter.
Yeah.
Thank you.
Thank you. Communication from staff facilitator, Valeria.
None at this time, other than to just say how deeply honored I feel to be sitting at this table in support of all of you, and just in awe again, and gratitude for your steadfast leadership and dedication to the safety and well-being of not just our community members, but New Mexicans as well. So thank you all.
Thank you, Valeria.
And thank you for your support.
Yeah, definitely. So I don't know, are you gonna share your screen?
Yeah.
Valeria?
I'm not in the Zoom. How do I do that?
Do you have the Zoom?
No. Let's see. Yes, I do. Give me one
Okay,
second.
just go ahead and join,
No, I do. I downloaded the thing so I can.
and then just make sure your speaker's down and your microphone's on.
Absolutely. Okay, thank you. Allow. Here we go. Waiting for the host.
Is that the right meeting?
Yeah, I got it from the agenda.
It might be the wrong thing for me.
Yeah.
I don't know if they posted the agenda.
That's how I found out where the meeting was.
Oh, you did?
Yeah.
Okay, so maybe I should have.
And I think they posted the agenda.
Let me see.
It was the
Okay.
link though. is the-
Yeah, the link has
Tricky
been
thing.
All
problematic.
right, let me go back in and.
Or maybe if I emailed you you emailed Alex the PowerPoint,
Okay.
or no, but you want to control it.
Oh, no,
What's your email? I can send you the link that I have.
it's a very long one.
Oh, okay.
One of
So
those.
do you have it?
Her email?
Yeah.
Yeah, I can
I'll
email
forward
it
this
to her.
to you and then.
Okay. Perfect.
Okay. That works.
It just sent.
Here all night.
I know.
Who are the Cowboy fans besides this guy?
Oh,
Right. I just have to say something. My Niners rock you where. Alex, are you a closet Cowboy fan?
No, Raider Nation. I'm just kidding.
Thank you.
I know I can't say that.
Got it.
Go Bears.
I just feel bad. I'm like.
We felt bad for the Cowboys too. We really did. By the third quarter, I was like, I hope he's worthy.
Okay. And just make sure your volume's on.
Yep.
Okay, perfect.
I got, okay, so now I need to be able to screen share when you have a moment.
You guys are having too much fun.
Why not?
What do you have in those masks? Is there some sort of oil that you can grab?
Oh, there's some sort of oil in those masks.
It says it's.
Oh, that's rude, yes.
I have a demented sense of humor.
You may have just invented something very lucrative.
That's
right.
Okay, I got it.
Oh, here we go. All right, fam.
Here we go.
Can you all see this, or do I need to, let me go to the slide.
Yeah, it's fine.
Okay, this is where we left off. And that way I can make revisions as we discussed. Back to you, Chris.
Thank you. We'll do presentations in the order that they are being presented. So is it who's taking this one? Transportation and medical access?
Oh, do you want me to take?
Oh, this
all
is
these?
you.
Yeah, this is me. Or this is us.
Mhm.
We have a representative.
Her name is Emily Kaltenbach.
Thank you.
Welcome, Ms. Kaltenbach.
Thank you. So, as I recall, we are gonna go by recommendation and stop for discussion, correct?
Yes, like we did it last time.
So the first recommendation, this is in our alternative work group. It is a lot of these focus, and just give a little background on the next handful of recommendations on community health and wellness and the importance of access to various services and healthcare treatment. And so, because that is going to make a vibrant, safe community. And I'm so happy that our task force is the community health and safety. And so it's really important that we recognize that health and safety are intertwined. So the first recommendation is about ensuring that we have accessibility to those social services, treatment services, and supports. And this actually was raised in our municipal strategy task force. And this was years ago. This was pre-pandemic, and we've altered it a little bit. We know that Albuquerque has a zero fares program and that transportation for folks should be free and they should be able to easily access services. We know that transportation is one of the biggest barriers to people adhering to treatment protocols or accessing various social supports, not unlike the findings when we looked at people, having lost or court or,
people frequently miss court because their license has been taken away and they have no other ability to get to court. So then a bench warrant is issued as well as $100, and you can get arrested simply because you don't have solid transportation to court.
That's right.
It's a major
So not
problem.
only healthcare, but other, the system or services in the legal system, and also benefit programs. I will say, shocked when the Medicaid and Income Support Division was moved all the way out to the end of Cerrillos Road by the Santa Fe New Mexican. I thought, oh my gosh, how are people going to access these services? So this is an attempt to do that.
Any questions or comments on recommendation number one?
One thing that potentially to add is not only to have create zero fares, but to expand service. Because I think the other issue is also that service is so limited that it makes it even harder to make appointments, or it's more difficult to get to a particular location so that you can, especially with the point that Emily made, which is that we continue to move essential services to the outskirts of the city, maybe even a little outside the city, and it makes it almost impossible for people to access. Not that I'm trying to add
I think that's a great
new things to all of our recommendations. Yeah.
And team, as folks are reflecting to your recommendations, I'm capturing those in the draft version in italic, so you know who and what was recommended.
Monica, I think you should put the word expanded right after ensure.
Yes,
Absolutely. Perfect.
Thank you.
Just ensure and expand.
Yeah.
On recommendation one.
And could we also add court services? Like, because right now it's very health oriented, and your point about, I think we failed to recognize that.
Absolutely. So
Did you get that?
Because the expand should be at the recommendation one.
Yeah.
Thank you. I was looking. Ensure the surgery very focused program similar to the and expand. I see. Thank you. Thank you for the
go
question.
To treatment. I mean, we could just say court.
Can we shut that door?
Sorry.
It feels nice.
Or not?
It feels nice.
It gives a nice fall atmosphere.
Yeah.
It feels really nice. I brought a pumpkin actually as
I don't
no
know.
big deal.
Oh.
There are spirits here.
Yes. So then it would be ensure and expand city bus routes go to all court facilities
All board facilities.
Yes, well, we could say court facilities, the jail, or what can we say, criminal legal facility, or,
It could go to like healthcare and, we could be general, we could say health and criminal legal services and social supports or something.
yeah, that's good.
Could we add court to the title of it and
Oh, yeah.
just leave it as,
I will leave it like if I could, transportation and access, because you're talking about various access.
Yeah, that's good.
Yeah.
That's great. Because then that also encompasses, it supports the detention center also, right?
Exactly.
Which then that's rolled in. And also, if you're on an ankle monitor, where you oftentimes, where do you have to go to get that service? You're going out to the jail. So, and which is a huge deal for all pretrial detention or pretrial services stuff. I mean, pretrial services happens at district court, but if you're under any type of supervision, you have to go out there as well. And your family has to go out there to pay also.
So actually, yes. So should I go to number 2?
yeah.
Okay. The second one also was very much informed by our community conversations, both at the MDS conversations, these conversations to advocate for right now, as we know, it's a release from the county jail, which is very far out of city limits, that there is limited access to services back in. And so this is to advocate that the city would advocate to the county to provide 24/7 public transportation. We pay for those beds. Most of the beds are paid for by the city. And so I think that the city has a important voice in how city residents are treated. And it's a definitely health and safety issue, because we know there have been, not only for women or people who identify as female walking back from the count for anyone. And also just there's a story about someone being struck by a car and killed on their way back in. That walking, and I see it a lot, folks just walking back.
Does that need anything about a centralized location? Mainly because if it's outside of the normal bus route time, where is the county bringing them to? Anyway, I think that's the question.
There's been so much talk about having some sort of like reentry resource center, because Albuquerque, there's other communities that have the reentry centers, and we don't have one here in Santa Fe, and that would be amazing, especially, but then you start picking, where does it go? What's central, right? And then, but yeah, it would be amazing if we had something like that.
Maybe just identified location, delivery location,
or a central location. I mean, some people.
Or appropriate location.
Yeah. Yes, go to home. Go home, right?
Right.
I say take them where they want to go. Right. Yeah. Exactly.
Yeah.
It's like a reasonable idea.
Right.
Yeah.
Within the county limit.
Okay. Make that note on the document.
Vegas.
Yeah.
Okay.
Next,
We're ready for
feeling complete there? Okay. Here we go.
recommendation 3. So as all of you may have recalled, it was a long time ago when we had a presentation by a couple of folks who, one, Caitlin C., who works at On Point in New York City for their overdose prevention center. There are 2 in New York City. I'll just share since then. They, in the first year, first year and a half, they've reversed over 1,000 overdoses and saved that many lives in their 2 sites in New York City alone. They operate in more of the supervision of the drug use is only one tiny piece of the services they provide. So they provide holistic healthcare, they provide case management, they have a community garden in the back, so it's really much more of just what we think about as a location where people can bring their pre-obtained drugs and use and leave. It's really about the bridge to recovery services, to wrapping services around people for what they need. So this recommendation is recommending that via resolution and through budget to community-based organizations within the city, that this is language, we're calling it wellness hubs. It could be called safe recovery sites. You know, there's lots of language out there, but the idea that we're promoting health, wellness, safety, and recovery services for people who are actively using drugs. I'm hearing more and more from people who are seeing people on Trios Road using drugs in public. We know that our parks have equipment that's littered. And I'll just say in New York, the city is so happy because there's very little syringe litter left. They were like, what is happening? And it's because it's being properly discarded. So it both is a recommendation for the public health and safety and for people who are actively using. And we know that there's a greater chance people are going to get into recovery when they have a safe place to use. They're not using on the streets. In public restrooms, business owners share how they have to train staff because people are overdosing in their bathrooms, in their restaurants. So there's more detail in what we sent out than what's presented here, but it's a list of services that these wellness hubs could include, including safe places for people to use drugs.
And Emily, didn't the neighbors, the neighborhood that surrounded these places, didn't they have positive things to say after they were implemented?
Yeah, I mean, definitely. I mean, part of that was just the syringe litter, one, and two, people weren't using. You know, in Canada, I mean, this has been a service that is 30 years old, and US is just embracing it. Rhode Island's going to open theirs in 2024, and other states are looking at it. So yes, so in other examples across the globe, it definitely has a positive community impact. There is definitely an issue of like, where does this exist, right? And I want to just emphasize that there are different models that can be embraced. They don't have to be brick and mortar. They can be mobile. There are now some incredible online where people can connect to someone. So we could be creative in what that looks like.
Any questions or comments on recommendation number 3?
I just have a not clarification, but can you relate it back to some of the statements made for our listening sessions and or survey, if there's something that you can connect it back, because I think that'll be an important piece to make the case. You know, it's like people don't want to see it out there, you know, see drug use, but they don't have a solution as to how to support people. So I'm always thinking about like, well, this is a great alternative. And yeah, and I guess I'm just curious if there's something we could tie it back specifically, because this one's a pretty, you know, bold suggestion to relate it back to some of the comments.
Successful. I mean, it is bold, but the fact that it's so successful is like, is that really what we call bold? Right.
So
yes,
we need to go back to our community engagement piece, and that's what I want to make sure we have here.
So I will say, in addition to the community engagement we just did, where people were talking about how, you know, there is more active drug use and more prevalence and people aren't getting the services and support they need. This was also part of the Municipal Drug Strategy Task Force. And when I was actually sitting in many of those community conversations, people said, why don't we have those services that exist in Europe? And that was at a focus group at Santa Fe Recovery Center with people who were in active treatment. So people, I was just like amazed that I thought, you know, I'm just a policy person, like no one knows that these exist. No, people were actually saying that. We also have done some polling around this. Both city-based and state-based polling. So we could pull in some of that into the rationale.
Yeah, I think the rationale part, it's not because we didn't hear from, I mean, in our listening session, it was very clear it was working elsewhere.
Yeah.
And to back it up by local experiences, lived experiences, to make sure that we're also hearing it from community, and you just described that. So I think that's a good example.
And I just think it's important to be said that if you've always done what you've always done, you'll always have what you've always had.
Mm-hmm.
And we've got to update the way we do business.
Mm-hmm.
And so that includes the city council recognizing that something needs to change.
Especially as New Mexicans, I mean, right, like the drug-related death rate in our state and in our community has been the highest. I mean, for the last 40 years, it wasn't until the epidemic, right, for what people refer to as the opioid epidemic took the sort of the country, that people started paying attention to this, but this has always been something that we've grappled with. And I mean, so many of us have stories, right? I've lost people to overdose. You know, when I was both a teenager, a child, an adult. We lost somebody yesterday. I mean, a couple of months ago. I mean, this is still like a constant problem. And I always think about if these folks had been with somebody else, they would have been resuscitated because they wouldn't have been alone or with somebody else who also passed out, right? And so it's just, I think this is such a big deal for our community. Like to your point, right? Like you have to do something different because we've been doing the same thing for such a long time. And it really, it's in all of our, it's really in all of our homes, you know.
Even those that don't want to recognize that it's affected every single person in this room in one way or another. And so I really want for people to hear that. When we present this to the council, we ask that we're raising the bar with you.
I just would love to remind the group that we have a lot of the anecdotes from community engagement, from MDS, from the community conversations, and from all the other research that we've done in that big rationale document that Valeria has and sent us. So hopefully, and so we have it right here in front of us as we go through it, but it would be good to just make sure, as per your request, Counselor, that in the final report, we're putting some of that information in there.
Yeah, we have them, and I don't think they've been noted yet, even in our working group, to make sure that there's things that we could capture that were said and stated in the listening session, so that we had rationale because we did listening sessions and all that, and we informed ourselves, but there's also this other piece that just to make sure they're folded in for our working group recommendations and your working group.
So each of our rationale with a lot of this anecdotal stuff is already connected.
And even in this section, you make a reference to On Point New York, which was one of the learning sessions you researched and allocated.
Right. Yeah, we're not just coming up with these recommendations. It's based on our listening sessions and also the community feedback. It's just that we strengthen it by just adding it in the final document because it's not in that. It's almost there.
It's not up here.
It's not up here, but it's in there.
So we all know this, but you don't know it. We have rationale. Links to all the communities. We did all that homework.
Yeah.
It's not what you see up here.
Right, it's there. It's not there.
We've had really good presentations from providers out in the country that are doing that. Yeah.
So the next recommendation should be quick because it's basically the same thing, but it is asking that the city pass a resolution requesting the state to authorize these types of services. And I'll just say that cities do not necessarily need state authorization, although, you know, so Rhode Island did it one way where they're the first state to actually authorize statewide or pass statewide legislation to authorize these types of services. New York City just did it because the mayor said, okay. And, you know, there's still some big issues out there around federal law and state law and local jurisdictions, but we see these really brave people moving forward in different jurisdictions just doing it. And there hasn't been any pushback from the federal government, you know, coming in and shutting down any of the services. So
That's number 5.
that's number 5.
They've
Sorry.
changed these up. a
They
little bit,
changed them
yeah.
up.
So-
Sorry. So I'm jumping to number 5. I will jump back to number 4. We also, we know in parks that there still continue to be discarded drug supplies like syringes. And so this is a budget ask in supporting the implementation. And I think some do exist already in the city, but really expanding access to public sharp containers.
Or the communities put them up themselves.
Exactly.
Like in the park by my house, I frequently go over there and there'll be like a McDonald's cup, or there'll be like a laundry detergent thing stapled to one of the poles, and there's syringes in there.
Yep. And so then who's discarding them and the safety around that? And so it'd be great if there was a more formal program. Okay, should I move to 6? Yeah. We also heard a lot in the community conversations about how folks just really didn't know what services existed and how to access them. And we went around and around in our group, sort of how do we recommend this? And there are, I know the county's working on a resource directory, like there's really isn't a need to recreate, but the request to the city is ensuring that those resource directories that do exist are accessible to city residents in a multilingual format and promoted in different ways, whether that's online, print, through different, you know, is that your phone, your water bill that you get some flyer that says go here to ask, you know, look at a resource directory. I don't know. But this is just a recommendation to help get this information.
Yeah. And Emily, I would just add in the recommendations document, I've added a reference to behavioral health collaboratives because they're set up by state statute, by jurisdiction, and they are focusing also on substance abuse, as well as county and tribal health council. So Santa Fe has its own county-based health council, also mandated by statute, and they have a significant focus on substance abuse in collaboration with NMDOH in collecting syringes and distributing Narcan to, you know, support people's recovery.
Yeah.
So I put that as a reference just for your consideration.
And I just want to note that in addition to substance use, this is also just greater behavioral health. So we know a lot of the times it's co-occurring, but there are folks that have no substance use problems, but are struggling with mental health issues. All right. 7. Okay, this is my last one.
This is the big one.
This is the big one. So we've had lots of conversation. We've collected a lot of data. We've learned from other communities who are doing a very similar process to ours of reimagining what public safety looks like in their jurisdiction. And so we're recommending that, and we also looked at call data. I want to say I actually went to the police department and picked up printed police reports to sort of think through what are the main reasons that people are calling 911 and ultimately having police respond. I want to applaud Santa Fe because I think the city has been leading the rest of the country for the last decade on alternative responses. So starting with the LEAD program in 2012, all the way to the alternative response unit, and the thought that went into developing those models. And, you know, where it started with ARUs started with 2 different types. One was a co-responder model with law enforcement. The other had just law enforcement as backup if needed. And what we heard was that the model without law enforcement was much more effective. And so just having the backup, because it, there's a lot more trust issues and people felt more safe. They didn't feel like they had done something terrible, they were more likely to engage. And so Santa Fe, I think, really is leading on this. And so this recommendation just sort of is jumps off of the point that we're at now. And so the recommendation is that we relieve police from responsibilities for certain public disorder calls. That could include drug and alcohol use, mental health concerns and emergencies, loitering, illegal camping, littering, things that are not necessarily creating a harm to the community, an emergent harm, so that we can free up law enforcement for those more emergent public safety issues. And so the recommendation has a couple of steps that in order to do this, we would need to enact sort of non-enforcement policies, because currently in our city code, a lot of these public disorder concerns are actually crime under our city code. So in order to really make the shift, we're recommending that the council pass some non-enforcement policies and name specifically that an alternative response should occur, whether that's the ARU or another new type of response unit. We heard from Kita and other folks that, you know, alternative response unit is really very built around more behavioral health type issues and not necessarily more like code enforcement, like graffiti, for example. Although they could be, you know, you never know when you're in, it really is person dependent. Like, why is someone loitering? You know, are they unhoused? Do they have a behavioral health issue? So we're not necessarily indicating what type of alternative response should be assigned to each, for lack of a better term, public disorder complaint, but that we need some additional responses. We heard that the ARU needs to be expanded. What was it, like 15? We could use 15 times or 15 more units than we currently have. They're also not 24/7. So the last goal is expanding them. And if you don't mind going to the next slide, I think we have a couple more bullets. Yeah, so creating the other non-police alternatives for non-behavioral health. We also said, like, well, where do we get this money? We should be creative. You know, in the Municipal Drug Strategy Task Force, that was before cannabis was actually legalized. We had recommended that those dollars that get generated through sales in our local community be reinvested back into our city services for behavioral health services. So, you know, I don't know exactly how much revenue our city is collecting, both in GRT and in the excise tax, but that's new money into our city, and we're in desperate need for more alternative response. So maybe that's a way to help support this. And then the last piece is really about making sure that we have a call structure in the RECC to be able to divert calls directly to ARU. Because right now our understanding is they don't get, you know, it's sort of, they have to listen in, and it would be really good to have a much stronger call structure that could, and training of the RECC staff to be able to decide how to manage that. And we know that that's also an important recommendation because it's county and city supported, and our understanding is that that system could be improved.
And we heard from our ECC director who presented to us, right?
Yep.
Yeah. So that was, I think, important to note. Did we, the last time we talked about this, I had talked about the park rangers that have this role in a way, and if that made sense to reference them and reimagine or restructure their work.
Could it be referenced in that first bullet point there? That's non-police alternative responses.
And you could say,
didn't we talk about that in our final decision, was just leave it open? It's not for us to say whether it's park rangers or create or add to ARU. You know, let them figure it out what the best way to really handle it is, so.
Let who figure it out.
Well, it would be,
Right.
well, it'd have to come from council, and then it would probably be, Kira's group.
I have one small thing. Until you get a 24/7, I think if my information is correct, they're 8 to 4, Monday through Friday. Maybe they should be different times, and maybe work the weekends when more of the problems are going down.
Absolutely.
And
street-based team.
until they get a 24/7 department where, you know, where they can cover it. But 8 to 4, Monday through Friday. Yeah. I think more problems are on the weekends and evenings. Does that make sense?
Absolutely.
Okay.
We've been saying that
Okay.
for a long time.
Okay, good.
Yeah, crime doesn't happen, or not crime, but issues don't happen from 9 to, I think it's 6 actually, but still,
Okay.
it's still not enough time. There's just a lot of need.
I think it also falls into, and it'll come up later, but how law enforcement is being called to the schools to respond to vapes. I feel like the ARU would be a really good resource for those students, rather than to be punitive and not have any services for those students that are being caught with, whether it's THC or just, we don't know, because there's been some overdoses with even Nick pens.
From a messaging perspective, if I can throw something out there, trying to aggregate Emily's description, I think if the beginning started on both recommendations with allow language like this, allow law enforcement to focus on emergent calls by relieving, because that's the intent. But if it's silent, I'm afraid people will misread this, sometimes intentionally, to say we don't trust the police to do these calls, versus no, really, we think they should be focused on the more emergent calls.
And that's probably in the rationale, but if we wanted to make it specific in the recommendation.
Yeah, and the bullet point, I think, just to phrase it.
Can you phrase it again?
Yes, allow police to focus on emergencies.
High level.
High level.
I don't know.
Hey, I liked emergent calls.
Yeah.
By relieving them from responsibility from
response. Okay, I'm just capturing it here and then I'm going to put it in the slide deck. Okay, thank you.
I would like to add, so I think from a messaging perspective that is important, and it would be doing that. But it also, I think there's been a lot of research that shows across the country. I just want to state this, it doesn't have to go into the recommendation, that really shows that non-law enforcement response, in addition to that, really does have in many ways better outcomes for these low level things in communities. So, I mean, there are two good reasons to do this.
Right.
Yeah.
Right. You get someone in there.
And I'm sure the police department will love that recommendation.
Yeah.
Right.
Yeah. Oh, yeah.
So a nod to them certainly, but I think there are two. And then I just want to reiterate something that you talked about a little bit, Emily, and that is that the ARU, part of why there are two separate recommendations on non-police alternative response for code enforcement versus it's just expanding the ARU to do that, is because we think of ARU as a very specialized set of folks who know how to work with people who are dealing with mental health issues and substance use issues, etc. And that's sort of its own thing. And they have to be trained to handle that in a good way. These other ones, you know, not everybody, and this was a struggle even in the community engagement, because the questions that they wanted to ask, which we would push back on a little bit, is, you know, expand mental health services, behavioral health services. And we're like, not everybody who screws up, excuse me for my prosaic language, but you know, not everybody who screws up has major mental health issues. I mean,
That's
they're
right.
young
Yeah.
and make bad choices and need often second, third chances for things like this. And this, I think, is what helps support that. So I just wanted to add that to the coverage.
That's right. There's a lot of other types of code enforcement units that we already have that exist on the county level. As a public defender, they would come in, they would have special prosecutors that would prosecute a particular code enforcement. This is somewhat like that, except for outside potentially of the criminal legal system and more dealing with it, you know, in the street, in the community where it needs to stay because it's so low level, right? And even with the kids, you know, I think about that, like with the ARU unit, they're so specialized, right? That it almost would be, you know, if maybe they would have like a special, you know, or there was a teen unit, or the school would just handle it, right? Because it's there's the school, right? And they handle school discipline anyways. And that some of these things don't need to always trigger, right? Like some sort of law enforcement or even an alternative response, right? Like the teacher can just have a response, right? Or something. I mean, I got in trouble a lot. And the teacher,
and here you are,
and the teacher, they had lots of responses, you know, and they tell them dance.
semi-legal.
You know, but that, you know, it's okay to talk to children and not have some huge unproportional response to, I think, teenage behavior, you know. Just one thing to reiterate what Marcela said, one thing that a lot of the public defenders find, and what I found, is that to the point of that not everybody has a behavioral health problem. Not everybody is addicted to drugs or addicted to alcohol. Some people just had a really bad night, right? And sometimes I would have prosecutors or the court sort of putting pressure on us to put pressure on the client to take a plea agreement that would include treatment. And I'd say, well, why would we want them to go into treatment? They're going to take up a bed that this other client actually really needs, or this other person really needs. They said, well, there was alcohol involved, there was drugs involved, and there's no true assessment of what that person's relationship with the substance is, that we're just sort of wasting resources so that we can say we're handling the problem. So you know, what we want to do is try to have a pointed response. What am I looking for? What word am I?
Precision response.
Yes, thank you.
Also, person-led, right? We have to be listening, like, what does this person need and want versus just a canned response.
Right. And there's so many canned responses within the criminal legal system. And the more we can get away from that, the better we'll be, the safer we'll be.
And I had an issue with not having a police officer respond with the ARU. From my background in paramedic and fire chief, so I went and did a ride along with the police officer, Officer Gonzalez, that followed the ARU around for, you know, a whole day, and I saw exactly what Emily was talking about, and that having a uniformed officer there with a gun makes the whole call different. And you know, they definitely respond better to just the paramedic and just the social worker than they do when a police officer is there. So I had to go see it for myself, and I was a believer after that.
Counselor.
Yeah,
and
really.
all the other people, you know.
Oh my God, you make me so happy.
The thing, right? Like then you have armed officers responding to traffic, right? And the reason why so many traffic stops go bad, oftentimes is because there's already an escalation based on who's responding to the smallest of the small, as far as infractions go. Of course, I'm not talking about DUI and some other things, but just straight traffic.
Yeah. Great. Any other questions or comments? All right, that was your last one, Emily?
That was my last one.
Thank you.
On to Marcella, right?
Maybe, I don't know, we'll see. Oh yes, economic security. So as we know, a lot of the community safety and health hide, not just in literature, not just from the folks that were giving us information from around the country, but also really rooted in the MDS stuff, as well as the community engagement listening sessions and focus groups. So we just have some high level, and we've kind of gone through the rationale in this, but economic security is a big factor in community safety and community health in all of these realms. So our high level recommendations are, they're not super prescriptive. So you'll see we're not recommending an amount, but we are recommending that in order to strengthen the economic security of low income workers, families, and youth, we need to raise the city minimum wage for tipped and non-tipped workers. So we have the tipped workers is the county. It's the county workers. It's still very low. It's $213 at the state level, and it's slightly higher, but I can't remember what it is at the county level. But we're not saying it has to be the same wage. We can let others decide that as we move forward, but we really do need to raise the minimum wage. I just want to point out in our rationale, Massachusetts, we have quotes from lots of different folks in the focus groups that talk about and say what factors are important to help create a more safe and vibrant community. And the most common factor chosen by 70% of respondents was good jobs that pay livable wages. 70% said that was the #1 way to make us feel more vibrant and safe in our communities. The Massachusetts Institute of Technology has a living wage calculator that has said that for a family of 1 working adult and 2 children, the living wage should be $39.33 an hour. And ours is 14.08 right now. Probably 14.03. It's in here. Read my own rationale. Okay. And for a working family with 2 working adults and 2 children is $24.13. So again, we're not recommending an amount, but this needs to go up. Anything?
And Marcella with a rationale that underscores this increasing living wage, given the inflation that we're currently, our community members across the nation, particularly in Santa Fe, are facing. And just reading that quote from that youth, it's heartbreaking.
I am 16, is this the one?
Yeah.
And the struggles we go through to pay rent each month are very bad. Whether it's my mom worrying about where we're going to be able to go for food to put on the table. I got a job at the end of the 8th grade to help out. If the mom were making more money, perhaps the kid wouldn't have to work at that age and spend more time either being a good student or doing other recreational things.
Being a kid,
right? Doing other things. Okay, so we're all good with that? Recommendation 10. And there's good stuff in the rationale. Thank you for.
Yeah, I'm following literally everything included here. It's so powerful.
So the other one is strengthening economic security by expanding city-sponsored cash transfer and guaranteed income projects. So we know that the city already has supported this through cash relief, and it's currently doing a wonderful eviction prevention strategy of providing cash, which, you know, is the least paternalistic and is shown to be one of the most effective ways to help folks across the board. So both one-time cash payments as well as recurring cash payments. So the city's in the process of doing that. It did it a lot during the pandemic for folks who were excluded from federal pandemic relief. What we really saw was that Santa Fe was able to get that money out, not through a third party, not directly to the landlord like the ERAP program at the state level, which had a really hard time unloading that because that's just not the reality. I mean, the reality of a lot of renters is, especially if they are formerly incarcerated, have really bad credit scores or are undocumented, have very informal agreements with their landlords. And those landlords often are not paying taxes on their rent. And so they didn't want to participate in any of those federal cash programs or eviction assistance programs. So we think double down on cash assistance, guaranteed income. There are many ways to talk about guaranteed income, but it's basically recurring cash payments for vulnerable folks. This was also one of the recommendations that UNM made in its report. We highlighted 4 sets of folks based on the community engagement piece that we think warrant an expansion of cash assistance. And that's low-income residents with young children, renters with high housing costs, vulnerable to eviction or displacement. It's kind of already happening. But if we wanted to do a recurring payment, that would be good. People experiencing homelessness. This is a little more controversial, but Denver has a really good pilot on giving money to folks in the community, and it's actually had tremendous success who are experiencing homelessness. And then also adult workers and youth and workforce development and job readiness programs, because when you're working 1.5 jobs or 2 jobs, don't have childcare, you aren't able to level up your skills necessarily and enjoy some of the other pathways, career pathways and advancement pathways that others do. So that's that.
Any questions or comments on recommendation 10?
We're already doing it. Let's do it some more, you know? Okay. What?
No, I love that. We're already doing it. Let's do it more.
Yes, let's do it more. Okay. Next. So, participants in UNM study and focus groups relayed the need for additional career pathways and opportunities to advance in their industries as well as better paying jobs. 53% of all participants in UNM survey expressed interest in utilizing job search assistance and workforce training if it were available. And 43% they would utilize services to improve their job skills. There are a lot of barriers to this. So the recommendation is to support and expand these programs for adult workers and youth through a coordinated, equitable workforce development plan. We say equitable because not all workforce development programs are equitable, you know. Somos is running with the city right now, the Economic Development Department, Office of Economic Development, a whole program on immigrant workers and how to integrate them into our workforce and economic development plans. And so we're seeing a lot of barriers come up that just really make these programs not accessible to poor people, to women, to youth, and to immigrants. And so we want to make sure that that happens, and we can only do that when we're working together with the community college unions and others. The last recommendation on this one is, this one's easy: develop and implement a city language access plan, an LAP for all departments as recommended already by the City of Santa Fe Language Access Study. Yes. We also, so the city conducted a language access 2022 evaluation report. It has really good recommendations that the city has not implemented yet because some of it takes funding, and I think the city wants to implement it. So we're just saying implement that fully and also incorporate, because this language isn't in that report, language justice principles in the language access plan. And there's a lot of training programs for that, and increase funding for live interpretation and translation services, and require training on language justice principles for city funded programs. And the reason why language justice is so important is, and those principles, is because people think that language access is just documents in Spanish or other languages, having someone in the back of the room interpreting for a group of people. And in reality, it takes a lot more integration and work to make people feel like they're fully engaged in their city and in the processes of the city in the language that they feel most powerful in. And so that is what the basic principles of language justice is.
Great. Any questions on comments on recommendation 12?
The language access plan is a 2-year phased-in plan as per the recommendations of this group called Pivotal Incorporated, which was paid by the city to put together this plan. And so we put a lot of details in the document, in the recommendation.
Thanks to Councilwoman Villarreal for her hard work on that.
Yes.
It's about time. It took 8 years to do.
Oh my goodness.
Yeah, we talked about this since I first got on council, but the last time we talked, we did say ASL was included in the recommendation, or is that later on? I was trying to remember if we included it or added, enhanced your recommendations, or where we put that, because I'm just going by our last meeting.
I think it is in the pivotal language access plan, so it's in there already. But when I read it, did not read it with that lens, and so we may want to read it with that lens. I don't know.
And I just want to recognize that Santa Fe has the New Mexico School for the Deaf. And we have to recognize that there's going to be a huge deaf community that we have to make accessible for them as well.
And just in this, I do like to highlight for anybody who was not there at that meeting, that 14% of Santa Fe residents speak a language other than English at home, and 11% speak Spanish. So this is a significant part of our community that wants to participate in all aspects of our city and access services in their language. Okay.
Anything else? We feeling good? Continue.
Okay, so this one, I'm going to pass out a consolidated recommendation that because we had a few more meetings with municipal court. So it's pretty much everything that's here, but in a more consolidated, way, and a little bit more high level and a little bit less prescriptive than we originally put in the recommendations. And that's in part because we had a few follow-up meetings to discuss these with relevant agencies. Just listen. We could talk about the lack of, for a long time, we could talk about the lack of restorative justice infrastructure, diversionary program infrastructure, and we could talk about it forever. We don't have practitioners. There are 3 people who do this work for the whole Santa Fe Public School District, and that's just in the schools. But we want to expand diversion programming and restorative justice programming. And I just want to repeat, and I always do, that diversion is a lot of different things. It's, getting counseling, it's community service. There are a lot of different diversion programs and services that are available in many communities, not ours. And restorative justice is one of them. And so we're not recommending restorative justice for everything, but we are saying that this whole diversion and restorative justice programming needs to expand. We need to expand it by creating more demand for it. Right now, there is no demand for it in our city because we don't have diversion programs for the most part. So I do want to recognize Anna, who put together a lot of those restorative justice sessions that we did. And also, this is for our counselors and for Valeria to include. We had 20 meetings or 19 meetings. In addition to those meetings that we had together, we talked to 19 folks from municipal court, from CYFD, from Juneau. We had 19 Zoom meetings since April of 2023 that she set up and that I attended to really help us understand what's lacking in this space and what's already being recommended, because, oh my God, you know how many strategic plans we read that already exist? One from the Violence Prevention Unit, from Children, Family, Youth and Services, from, a lot of strategic plans that are partially being already implemented and partially not. One of the things that we saw in all of these violence prevention type strategic plans was that they would say, we want restorative justice programs, or we want a coordinator to do all of these things, including restorative justice and diversion programs. What we saw in all of the current agencies, including CYFD, Juvenile Probation and Parole, you know, notwithstanding the executive order that the governor put out suspending all alternatives to incarceration for youth through juvenile probation. But beyond that, there has always been in every aspect, particularly for youth, a desire to divert away from the criminal justice system, the formal criminal justice system, and to support with a lot of support services, love, diversion, restorative justice, the whole bit. So, we don't think it should be 10% of a person's job description or 10% because we need to pilot some programs and create an infrastructure. So that is why these are the recommendations that we're making. And there's a lot of rationale behind this page right here. And so we consolidated it. We think the big recommendation should be expand restorative justice and diversion program in Santa Fe by initially funding a full-time diversion and restorative justice coordinator to convene community youth, public school, municipal court, and other stakeholders to establish, implement, and identify funding sources for a comprehensive diversion and restorative justice plan. I didn't call it a strategic plan because I read too many strategic plans. It seems like nothing happens with those. And so we want this plan to incorporate the Santa Fe Public Schools, the municipal court, and the general criminal justice system. We don't know where this person should be, and so we don't need to make a specific recommendation, but I know Councilor Villarreal said it might go well under the proposed Equity and Inclusion Office. Is that what it's called?
Office of Equity and Inclusion.
Okay, sorry, I got that a little bit wrong. You know, it could be under, we don't think it should just be for youth, but it could be under the family, you know, youth and the Children and Youth Commission, which is under the Youth and Family Services Department, which is under Kira's department, I think. And then there's another thing called the Violence Prevention Unit that already has a strategic plan that incorporates, although they haven't done it, it incorporates doing a hiring or contracting someone to help with all of their programming. And then they say, including restorative justice and diversion programs. We think it needs to be one person to coordinate this plan and to get the ball rolling. This plan, and this is where our 4 pieces come into play, should include, in concert with the Santa Fe Municipal Court, we should create and fund a pilot restorative justice and diversion program for all youth under the age of 25. Right now, they have a really interesting and new, and I wish we had invited them had we known, outreach court. Have you guys heard of the outreach court? Have you? Isn't it great?
Did you say the what?
Outreach court. This is a diversion program for people experiencing homelessness. It's new. They have a coordinator. They don't have enough referrals for it. So they want to keep building it out. We talked to their pro tem judge and the coordinator. They want to keep building it out. And so we want to see that fully built out, but then also we want the city to help support with funding and a more robust diversion program for all youth under the age of 25. We also want to see the plan create a formal pre-booking diversion program for all youth under the age of 18, with obviously certain crimes accepted that would be determined by community and city stakeholders, including law enforcement. And so that is in the recommendations that you've already seen. We want this person to help start coordinating and funding a restorative justice training program for community volunteers and paid practitioners, because we just don't do that. And then lastly, in concert with the Community Health and Safety Department, community stakeholders, and the Santa Fe Public Schools, we met with the superintendent, their security folks, their restorative justice people, and obviously we have the expert here with Mary Louise. We want to support the expansion of RJ programs. They're really wanting more RJ practitioners in the schools, but we want, you know, originally we said an MOU that may feel a little too granular. We want a coordinated RJ and diversion plan to prevent not all arrests, because some arrests are going to be necessary on school grounds, but the police are getting called to the schools often for small things. And even though the police will respond when they get called, often, there should be a coordinated response so that they're not wasting their time going for these small things that can be handled in the schools if we supported diversion and RJ programs in the schools. And so we really do want to reduce, we don't think it's a widespread problem, but police do end up on campus, on school grounds, and we don't send our kids to school thinking that they're going to get interviewed, arrested, or charged on school grounds. And so clearly there will be exceptions to that. But for a lot of the low level stuff, no. And then I just want to turn it over to Mary Louise to see what she wanted to add to that last one.
So I really envision the city working in collaboration with the Santa Fe Public Schools to start recognizing how can the city, so I don't know if you all know, but the Children's Commission, I think that's what it's called, funds one of our restorative justice program. It's an elementary, and they're funding it right now. I think for sustainability I think the Santa Fe Public Schools needs to partner and get some support from not only the city, but from the state to recognize that these programs work. We think about the school to prison pipeline, and I feel like because there's not enough of us practitioners, there's only so much that we can do. And so let me give you an example. Today I had to come to this meeting. If I didn't have to come to this meeting, I would have probably worked till 7 o'clock tonight because kids are actually accessing the program themselves. They'll come to me and they'll say, Miss Mary, I don't want to get in trouble. This happened and I would rather handle it in a restorative way. And that's probably because they've been referred to my program through administration, and now they're asking for the help. And so we really, I feel as though I can't do it all. I have to do it myself, but I can't do it alone. And so there's just me working at 7 schools. Already this year, we've had 340 referrals. We have 1 elementary person, we have 1 middle school person, and the program is now strong enough to where those relationships that the practitioners have built, that they're knocking. I mean, I get texts throughout the night. I haven't been coming to school because I don't want to get into a fight, or I haven't gone to school because the police were called on me for a harassment, and this is happening outside of the school. Can you help me? Because I want to make right my wrong. And what's so beautiful about this program is juvenile probation supports the work that we do. Sometimes they send us referrals because they would rather it be handled restoratively rather than punitively. And I want us to all think about a time that we weren't at our best. And maybe you got suspended. You talked about getting in trouble a lot.
I've gotten suspended a bunch.
Imagine.
I got arrested.
Imagine elementary, junior high, and high school.
See, but think about this. When students come in and they're given a safe space to talk about what got in the way of me being at my best, who did my behavior affect, and what do I need to do to make right my wrongs? And when we can go through all of this, the process just creates this different person. They leave better than they were before they walked in because they're given an opportunity to face the people that were affected by their behavior. And sometimes I think we're missing the boat. We're creating that school to prison pipeline, and suspensions need to come to a halt. And I'll give you a perfect example. Today, 2 girls almost got into a fight. The principal texted me and said, I have 2 girls and I would rather not send them home. Can you help them? I'm never going to say no. It kind of messed me up because I had other things scheduled for today, But let me tell you, in 20 minutes, I brought these girls in, and the first thing that we do is we talk about values that you're going to bring into the meeting so it can be successful. The first girl said, I promise to be respectful, I promise to listen without judgment, and I promise to accept responsibility. The second girl said, I promise to own my stuff, which means taking responsibility. I promise to listen and take responsibility for responding to the behavior that happened, whatever that was. And then they have this dialogue. And when they walked out, because we take them back to the principal after, and they get to tell the principal not what we talked about, but what they learned and what they'll do differently. And what kind of support do they need from the staff so they can sustain this, right? And imagine if they would have sent these kids home. The studies prove that when you suspend kids, they are more likely to drop out of school or be very truant. And so we need to look at this as a community, and we need more practitioners, and we need people trained, and yes, volunteers. And I'm telling you, we can make a difference in this city, and we can get graduation rates at a higher rate. We can do so much, but like I said, I have to do this myself, but I can't do it alone. So come help me.
So they have, can I
just a question, because you had mentioned meetings and meetings with the schools. Have you received a rationale why so many calls are made?
we don't know how many calls are made. We asked and they don't keep so I don't want to overstate
Or
what I
the
can
rationale
say.
for why calls are made?
So they have a code of conduct.
Code of conduct, the code of conduct. It states in the code of conduct that if there's like a vape or whether it's THC or not, because sometimes you can't even tell, are found on campus, that you have to call law enforcement. But yet law enforcement won't pick up whatever they find. They won't take the paraphernalia that they find, right? And so it's in the code of conduct. And so some of the principals, they're not sure what to do.
So do you want to tell us what the code of conduct,
Yeah, and I'm sorry, I didn't hear what you just said, but the code
is
of
it shall or may?
but I went into the student code of conduct and I pulled out all of the reasons why they'll call her.
These are high level offenses, is what they say.
There are 2 columns in the code of conduct, and then there are the shalls, and then there are a lot of mays. And a lot of the mays, so there's no predictability of when the mays are, because it's up to the discretion of pretty much one person at the Santa Fe Public Schools and not their security chief.
And they call them every time.
So we have, I don't think we have copies of the code of conduct, but yeah, it's okay. So basically they can call when they want for a lot of different things that are both low level and high level.
So like police will be called, do you want me to read some of them out to you?
There's so many.
Yeah.
But if you look at her tablet, those are the shall. And then on the left-hand side,
this is
are the
can be
names.
called.
Can you just mention a few? Because I think it needs to be on record.
So police can be called for inappropriate use of district technology, trespassing, extortion and coercion, assault, other violent crimes, lewd conduct, sexual harassment, bullying, possession, and or use of firecrackers, reckless use of vehicle. Some of the ones that police will be called for, or assault, battery of a firearm, sexual penetration, other violence, homicide, other violence, kidnapping, robbery, using force, threat, intimidation, hazing, stalking, a hate crime, tampering with safety and security devices, criminal damage, breaking and entering, burglary.
So I'm not saying that they shouldn't. There have been some really high level things where police need to be called, right? What we're seeing, or what we heard, was if before calling the police, what all of the principals are supposed to do, or administrators, is call their head security person, who was a former police officer, and who was the former deputy police chief, right?
Yeah.
Mario Solis. And he decides, based on his own criteria and judgment, when the police get called, when the police get allowed on campus, etc. So it's one guy. So we asked, is this based on policy? And so I said, well, it's the code of conduct. But as you can see, there's a lot of discretion even within the code of conduct. And so we don't have jurisdiction. We can recommend, we don't have jurisdiction over suspension. They do suspend, they do expel. We can make recommendations to them if we want. But what we're suggesting is that for the interaction of law enforcement and students and on school grounds, that should be a negotiated, mediated agreement. Like we should be able to say, listen, the police don't necessarily want to get called on these low level things, or we would prefer that you divert and put those folks into restorative justice programs for these low level things instead of calling us. That's something the city can, with support of more restorative justice and diversionary programming, and the schools can do. So we're not saying anybody's doing anything wrong, and we're not trying to tell the schools what to do at all. What we're saying is this coordinator should bring together the stakeholders and say, we're not interested in participating in this school to prison pipeline. We're not interested, without thinking it through together. That's all.
Thank you for that.
I think there can be a lot of power in not tracking children, right? Because there's a shame spiral that can start to happen, that then it's sort of a self-fulfilling prophecy, right? So you have children that start to be tracked by the system, and when they really didn't need to in the beginning, especially, I mean, criminal damage, I mean, some of these things, right? Criminal damage to property, I mean, that can be pretty minor, extremely minor.
And
Assault,
imagine if they could,
super minor. You haven't even touched anybody, right? I mean, and it's interesting, sort of, if you think, because I talked to my mom about what it was like to grow up in Santa Fe, when she went to Santa Fe High, was in high school, and the amount of conduct that sort of was fine during sometimes is not fine now, right? And we see children being tracked at a very young age for things that really have no business. So I love this example that you gave about conflict resolution. These are real life skills that children can take into their adult lives.
and I just want to say out loud that there's not been one time, and I'm going to knock on wood when I find some, that a student has refused to work with me. Like, I explained to them that I create a safe space with you to talk about what got in the way of you being at your best. And you don't get to come in here and say what that person did. You tell me what you did. And I'm going to create that safe space for you to own your part. How many adults need that in their life? Let's think about it, right? And so these kids are learning these skills at a young age. And I received those successful little, Miss Mary, I handled my own restorative justice, you know? And, you know, that's what we want, is we want to build their toolbox. And sending them home doesn't do that. And so, and I just want to say out loud that
doesn't always do that.
I really appreciate all of our administrators, because they would rather ask me to facilitate something. But oftentimes they're looking at the code of conduct and saying, well, I just called and now I have to do this. And it's sad, because I still get to do a restorative justice when they come back, but they've missed 3 days of school, 5 days of school, so they're behind. So let's think about that. Like, what are we really doing, and what is our goal? You know?
And I want to reiterate that the schools were so forthcoming, and that the beacon right now on restorative justice programming is at the Santa Fe Public Schools. And so what we heard from them was, we want more practitioners. We need more support for this citywide. And so the desire for that is coming from the schools and their leadership. And so their biggest, because we asked all of these 20 people, we said, well, what would you recommend? What ideally would you want, right? And they said, we want more restorative justice practitioners. they have all these safety aids, and we said, oh, you know, why don't you train the safety aids? I think that people think that restorative justice practitioners have to have, like, I don't know, an MA and who knows what, mediation, psychologist. No, these can be community people that are empowered and that are trained really well. And so in order to do it, we need to create the demand. We need to create the infrastructure for the training. We have such an amazing trainer here who's been trained by other people. And then lastly, I just want to say, people don't know what restorative justice is. Restorative justice, I mean, so one, we have to educate the community about what it really is. But one, we need, it shows that people who engage in these restorative justice processes, the recidivism rate is so much lower than any other form of intervention. One. Two, that it is the most satisfying for victims, or what we call the harmed parties in restorative justice parlance, right? And that is that the adversarial process of the traditional punishment doesn't do the person who committed the transgression any good necessarily, but it also doesn't allow the victim or the person who was subjected to this act an opportunity to engage and so there's accountability. All the research shows that this is good for adults, but also for youth. Yeah. And that's all in the rationale, which she will incorporate.
So just a quick check time. Thank you so much, Marcela and Mary Louise and everybody. We have about 4, 5, 6 recommendations left, and it's 6:57. I just want to do a little quick time check with all of you. If we're feeling complete, are we okay to move to the next? You good?
I can be very fast.
Should we take a 5-minute break?
No.
Yeah, it's okay. Or...
No, we can, if you want. But we can't, oh, you don't want to,
move on.
hurting cats is sometimes hard. So if you need to take a bio break or whatever you
Go
need,
ahead.
do what you need to do. Get some more food,
And this is yours,
get
right?
something to
Yeah.
drink.
Yeah.
But I think we should keep going,
Yeah.
Okay.
because we won't finish. We can't continue on.
Okay, so thank you. So the next recommendation is with Monica on fines and fees.
Sweet.
Yes.
Recommendation 16 is eliminate all municipal court fees. This includes but is not limited to post adjudication fees, and what those are is that whenever you have a criminal conviction, and in New Mexico, we criminalize traffic offenses. We're one of 14 states that criminalizes traffic. So it includes traffic offenses to a felony. We attach a series of fees at the end. The fees are not fines, because fines are different. They're punitive. Fees are intended to raise government revenue. Yeah. So there's a series of fees you have to pay. They go to all sorts of different things, right? There's the court facilities fee, for example. The facilities fee, you would think that when you pay this facilities fee, that fee goes into the courthouse that you are in. No, it does not. It goes to pay for Metro Court in Albuquerque. This is just an example.
Say that again, fines are punitive and fees
are intended to raise government revenue.
At the expense of whoever just got arrested.
That's, or convicted, right? And that's anything from something as small as a speeding ticket, to something as large as, you know, a first-degree felony.
Because we don't want to tax the rich, so we decide to.
Some could certainly color it that way. Yeah, you know, there's different ways
That's one of our recommendations, tax the rich.
Yeah, exactly. I think we have a recommendation from the.
I might have this recommendation.
Evan, that's not the case.
Yeah, so, question.
Real quick, did I hear something that collecting those fees is actually, it costs more money?
Sure does, and I'm happy to share.
Yeah. Well, you don't have to, but I just remember that.
Yeah.
Yes,
that's right.
Yes, so, and so I'll go through this and then I'll talk a little bit about that, which is the huge one. So it's post adjudication fees, supervision fees, which include things like ankle monitors, sober links, TAD. A TAD is an ankle monitor that actually gauges what your blood alcohol content is in your, but just by touching your skin. Probation fees, there's different fees that you have to pay to your probation officer, other types of supervision fees. And then of course, bench warrant fees. Bench warrants are issued when you fail to appear to court, fail to pay, your fine or your fees, because fines always come with fees as well. And there's also failure to comply bench warrants. Also, when a bench warrant is issued, there's a fee that comes with it. Sometimes, so municipal court is different, but it looks like they are charging $100. That's the state fee as well. But a quick point, which is that the purpose of fees is to actually raise government revenue, but what we found is they actually don't even do that very well. So a wonderful study was done actually in New Mexico. It looked at 3 counties, Bernalillo County, Socorro County, and Santa Fe County. This is looking at magistrate courts, okay, state court. But what they found is that in every county, we really weren't getting the revenue that we wanted. And in Bernalillo County, they spent $1.17 to collect a single dollar of revenue. They were actually losing money. So they actually don't do a good job even doing what their stated purpose
And they stress people out.
That's also true. Thank you. They do. They put a lot of economic stress on our communities. One thing that I'll say just really quick, just as an overarching, just think about this as we go through these, is that at the state level, the New Mexico Supreme Court was behind one of the largest fee elimination efforts in the country. So our Chief Justice was the primary witness and pusher for a state bill that recently got rid of almost every single post-adjudication fee. That touched 3 municipal fees, but not the rest. So that means that even though statewide, come July 1st, 2024, nobody will have to pay post-adjudication fees except for the facilities fee for a little amount of time, and I don't need to explain that. Even though you won't have to do that at the state level, you will have to do it if your case is adjudicated in city court, in municipal court. Santa Fe, I think, is one of those courts that could get rid of the rest of those post-adjudication fees, much like the magistrate court, because that means that the difference between how much money you're paying, it depends on if the city police officer decides, I want to file this in municipal court or I want to file it in magistrate court. They could say, well, actually, I want to file it in municipal court because then you're going to have to pay more money. But we could put municipal court on par with the rest of the state courts.
So that just changed recently?
It did.
Okay.
It
and
did.
That state, and you said magistrate falls under.
Yeah, magistrate is all under the state system. We don't have a unified court system. It's a little bit ununified because we have the municipal courts and then we have the state system, which is magistrate, district, court of appeals, and the Supreme Court. We also were able to get rid of bench warrant fees at the state level. So no longer when a bench warrant is issued, people at the state level will not have to pay $100 every time one is issued, but you will if you are in municipal court. And people have to pay bench warrant fees even if they were found not guilty in the case or the case was dismissed. They still have to pay bench warrant fees. So that's an issue. Same thing with supervision fees. You could be found not guilty on the underlying charge, but you had to pay supervision fees, which are all the ankle monitor fees, SoberLink fees, TAD fees. You'd have to, so there's a lot of things you have to pay for when you have a case, even if you're ultimately found not guilty.
And in the rationale, you stated the fact that we should be on par with the state, these state.
I believe I did, and if not, I'll be sure to include that in there. The other thing that I want to reflect is that this follows the we had a presentation a very long time ago that highlighted many city officials from across the country that have started to implement various reforms. And our wonderful counselors even attended a wonderful conference in boot camp. Oh yeah, well, it was like a conference, but if I say boot camp, that nobody will know what I'm talking about. A conference in Phoenix regarding local reforms and fines and fees. Also, one thing that we saw over and over and over in the community engagement survey was everybody wanted us to implement policies to reduce economic stress on individuals and especially families. And also to improve police and community relations. When we turn police into bill collectors, we really start to pick at the fabric of any sort of trust.
They have to collect
Well, they have to go out and they have to go and look, they serve bench warrants for failure to pay and take people into custody just because people couldn't pay. Also, I want to mention that debtors' prisons were abolished in the US and I think it's I'm gonna forget, I think it's 1833, something like that. The Supreme Court has also established that you shouldn't incarcerate people simply because they don't have any money. You have to first find that it was willful. But here we are, and we often incarcerate people just because they don't have any money. Moving on, any questions so far? Recommendation 17. Creation and execution of an exhaustive performance audit of how fines and fees are collected and dispersed. This isn't totally necessary. However, if the city were to want to do this first, they could, just to really see how much money they're bringing in. I know that we met with, you know, we've looked at some of the city's financials and some of the municipal courts financials to see how much money they're getting. And I actually was able to discuss that with state court officials, and they were shocked at how much money the Santa Fe Municipal Court brings in. I also want to share that we did a big sort of survey project on the impact of fines and fees to New Mexican families. And we went to both rural and, you know, it's hard for me to say urban New Mexico because are we really urban anywhere?
There isn't.
Yeah. But we went to both cities and rural areas just to talk to people about their experiences. And it was so devastating, especially to hear that the vast majority of people that owed fines and fees also had families and had small children. The majority of them also engaged in risky behavior in order to pay those back. So they broke the law in order to pay, which actually shows that fines and fees increases crime, doesn't decrease, which it seems like what we want to do is the opposite. And that people have severe economic pressures. But the fear of going to jail because you can't pay will encourage people to go out and commit crimes, even if it's something as small as your license was suspended and you're going to continue to drive in order to get to work so that you can make money to pay. But the performance audit, this was a suggestion by a city official from Philadelphia who came and spoke to us. It was and he was actually the city auditor. So he went through this. There's lots of information in the rationale about how you could do this, but it's one way that the city can just sort of look and see, this is what we're doing. This is how much money it's costing for us to do this. But also, you know, we've done a lot of the legwork for them, and the Brennan Center report also did a lot of legwork for them. So it's not totally necessary. Recommendation 18, create a municipal court ability to pay standard, including presumptions of inability to pay. This is somewhat technical, but it kind of makes sense, right? The vast majority of people that, sadly, that come into the system tend to qualify for a public defender. And in order to qualify for a public defender, you have to show what your income is. So the public defender has to do an assessment of your ability to pay, and it means that you qualify for a $10 attorney. I'm not sure why we then require people to pay huge fines and fees on the back end when we already know that they can't pay. So this is sort of a presumption for an inability to pay. That we could create that presumption that if you qualify for the public defender, you do not have to pay fines or fees. If we already eliminate fees, which is what the state has chosen to do, you eliminate post-adjudication fees, you don't have to worry about that issue because nobody's going to pay them. Ability, and one thing to note, the ability to pay standard, that's a constitutional right, both in our federal constitution and in federal case law. It's also a New Mexico court rule. But as a public defender, I almost never saw the court do an ability to pay inquiry and see if somebody could actually afford what they were required to pay. So the municipal court could have a pilot ability to pay standard and sort of model this for the rest of the state. which is looking, and it's really significant when you look at fines, right? Is that people should pay with a fine, because a fine is different from a fee, that it should be based on their income. So that you don't have a two-tiered system where you have people who have money that can just quickly get through it, and people who do not, who stay in the system. There's serious economic roadblocks throughout the entire experience. So we would be essentially, this would be a way to get around that. Let's see. Recommendation 19 has to do with drug possession for personal use.
I don't know why it's in this section, but it is, we should probably call it fines, fees, and penalties.
Yeah, I mean, I can talk about it.
And also,
I think we were trying to consolidate under theme. Yeah, sorry.
And just about the last, there's something funky about the last. It should just end after the first period.
Fines, fees, and
so
thank you, Renee.
So at the state level, there's a big push to reduce drug possession from a felony to a misdemeanor. We essentially would like to talk to the city council or encourage them to introduce a resolution to support the reduction of this penalty. This is something that the city has done before, where they publicly support the state push. Emily, do you want to say more about that?
Yeah, I'll just say that this goes, just aligns with what you're just talking about, is that, and people don't realize, even a trace amount of substance in paraphernalia is a felony, other than, marijuana and a few other substances. So if you found to have heroin, literally a trace amount, you now are a felon for the rest of your life, and we know the collateral consequences of that, and that people can't engage back into their community because of that record. So, and this just also aligns with what we talked about for enforcement,
right? That
possession should be non-enforcement in the city, and this would help support that. And just, we need to take out the last half sentence at the end. And Oklahoma did this, so I think the next one.
Yeah.
Oklahoma did it.
Through a ballot initiative.
It's amazing. Oklahoma has done some wonderful things with fines and fees. They're trying to do a lot of stuff. I'm not sure. So I'm not sure if it's next, but it's another one, which is eliminate the ability. Okay, cool. Eliminate the ability of the municipal court to issue bench warrants for failure to comply, failure to appear, and failure to pay in traffic cases. So traffic is the lowest of the low when it comes to infractions. It's not something we want to waste law enforcement time on as far as serving warrants. The idea that my grandmother could go to jail on a traffic bench warrant for a cracked windshield is something that makes me uncomfortable, so I'd have to bust her out. And I think I would want to bust out most of your grandmothers. And I've actually had to be at arraignments and have elderly folks that were arrested on traffic warrants. It's not a good thing. The vast majority of states don't criminalize traffic, but New Mexico is one that does so. The city of Santa Fe could be really instrumental in, and be, again, a model for the rest of the state in saying we will no longer issue bench warrants for your arrest because you missed a court hearing on a traffic case or you couldn't pay. These are sort of things that we should leave, and also police have enough to do, right? For them to be serving bench warrants, and serving a bench warrant takes a lot of time, right? You have to wait for somebody's car to come and get picked up, right? Like once you make an arrest, you have to wait for towing to come. Then you have to take the person to the facility. They get booked in. Booking somebody at the jail takes at least 2 hours, sometimes longer. When you're doing that for something as small as somebody couldn't pay for a traffic offense, I think we can do better. Recommendation 21. eliminate law enforcement traffic stops for certain offenses and employ instead independent unarmed traffic monitors in their place. This is this is your favorite, Bruce.
No,
Okay.
there was something on Nextdoor today. Some woman tried to get scammed. She was sent an email that she had been caught on a traffic thing and she had to pay $131.57. And it was like, really? Did this city send you an email that says you? But it's a scam though.
Well, and that sounds like a scam. I think this is the thing that's hard, right? I would think it was a scam if somebody said there's a bench warrant for your arrest because you had a cracked windshield and you didn't show up, and then you're actually taken to jail for it, right? So it's sort of, you know, a part with, but that seems very like equal to me. Yeah. But also, I'm so bad for that woman.
Can you say more about that independent
yes.
unarmed traffic?
This was one that we talked a lot about throughout the 2 years that we were working on this issue. I also think it's interesting because for a lot of people, the traffic stops is sort of the catalyst to a lot of people nationally talking about criminal legal reform. This is something that has been done in Philadelphia, Los Angeles, Pittsburgh, Seattle, San Francisco and Berkeley, Lansing, Michigan, Brooklyn Center, Minnesota, and the state of Virginia. There's probably others. The idea is just like what we were talking before, when you have armed police officers engaging in traffic stops, it unnecessarily escalates the interaction. And can lead to both law enforcement being in danger as well as the individual being in danger. Especially when, again, traffic is the lowest of the low. So what some communities are trying to do is instead have independent and they're unarmed traffic monitors, much like a meter maid. I don't really like that phrase.
Yeah,
I know, but
it's a person.
People. Yeah,
it's a person versus a machine. So I just, when I hear
I'm happy. Oh no, I'm so happy to talk about that as well. And there's a little bit in the rationale, just a note about automated traffic enforcement and a lot of the problems nationally that have occurred for automated traffic enforcement, including that it's a big money maker, and that these are private companies. There's 4 that actually will contract in for cities that we will come and we will bring our cameras. But we will do that. You'll have to shorten your yellow light time frame, and this is part of sort of their contract process. And they'll have various other sort of stipulations in the contract because what they're concerned about is revenue. Albuquerque has a pilot automated traffic enforcement program. They're having a lot of problems with it. And there's state legislation that's been introduced to also curb automated traffic enforcement in the state, including stopping the ability for these companies to put additional fees on an automated traffic ticket. There's a lot of due process concerns with automated traffic enforcement, including that you have to, in order for these tickets to even be valid, you have to have a law enforcement officer review every single one. But then the question is, where can you actually go to court and challenge it? So it creates a huge administrative burden that's really expensive, actually. So there's lots of other problems too, community relations, privacy concerns. I put some of that in here, but again, the recommendation is for there to be unarmed traffic people that come and actually stop folks, but they're unarmed.
Can I suggest we say monitor a different way? Because when I read monitor, I was like, there's a machine. But people might think think it's a person.
Unarmed traffic
representatives.
What's going to stop someone from not stopping?
Do you think so? That
I understand, because most police departments now have no pursuit policies, and that's a good thing.
Oh, I agree. It's a good thing because we've had some tragedies. I would say that most people stop, and if you start to flee, then the idea would be is that traffic monitor would then radio law enforcement, and then they would have a different situation because they would be.
Maybe the guys wanted to, or maybe they wanted a warrant. They don't want to stop because of that.
Well,
that's all I'm saying.
Yeah,
I mean, something there.
Here's the thing: is that when somebody has a warrant, if, again, one of the reasons why that interaction is escalated is because they know they're being stopped by law enforcement who could take them into custody. A traffic monitor is not going to take anybody into custody. So a huge piece of this is the public education. The public needs to know they will no longer be stopped for traffic infractions by law enforcement, meaning that there is no reason to flee. So one thing that a lot of these cities have done, and this would be prescriptive, right? Like each city would decide how they're going to do this, is that the traffic person, what should I call them?
Traffic monitoring person? Enforcement?
The traffic enforcement
Or enforcement
individual.
Traffic.
But the traffic enforcement, that they would have a very limited scope of what they're doing. They're gonna run insurance, run registration, these things, but they're actually not doing warrant checks. The warrant check is for, that's a law enforcement activity, right? Just like when you have somebody that's doing parking, they're not checking for warrants based on who the owner of the vehicle is, right? So the idea is if law enforcement is using traffic, not because of public safety for traffic, but more as a means to search the vehicle or the person, that we are saying we no longer want them to use traffic as a way to do that because it puts the community as well as themselves at risk. Instead, we want traffic enforcement to really be about community safety and about traffic infractions, not necessarily a search and seizure tool, because law enforcement have lots of search and seizure tools. Traffic doesn't need to be one of them, because that's why we sort of have this problem to begin with. And where there's these huge excessive uses of force, we have people fleeing. These are all because of the nature that if you know you have an active bench warrant, yeah, you actually may take off, right? But if you know that the person that's stopping you does not have the ability to do that, you're more likely to comply.
I agree.
Did you say that they were doing this in other places?
Yeah, I mentioned that. Yeah, it's Philadelphia, Los Angeles, Pittsburgh, Seattle, San Francisco, Berkeley, Lansing, Michigan, Brooklyn Center, Minnesota, and the state of Virginia. There's probably others.
And they're all making it work.
They are making it work. I will also say that this is something that was specifically asked for to a certain extent, you know, when we were in meetings with Kira and law enforcement. Also, I put the page numbers for the community engagement survey, right? It said replacing police across several low-level calls is highly popular among Santa Fe residents using non-police personnel for low priority calls. As the vast majority of respondents believe that reforming the way nonviolent offenders are treated by the criminal justice system would generate revenue that could be reinvested back into the community. This is sort of talking about the waste of resources when we just have police constantly doing all of these traffic stops. I mean, I talked to me myself. I mean, you call the police, how long does it take for them to get there? It can take a really long time. You know why? Because they're out patrolling for traffic. Instead, they could actually respond to some of these calls and actually prioritize other things. There's a lot of other throughout the community engagement that was like, please do this, please do it now. But not necessarily for automated traffic enforcement. What we found too is that automated traffic enforcement is net widening and doesn't necessarily reduce the amount of time that law enforcement engages with the public. What it does is create a whole lot more tickets without inexpensive administrative way to deal with the tickets and all the due process concerns. Not to mention it's a huge revenue generator, and it just, but people don't really like the automated traffic enforcement generally, but it has been pushed a lot. I would say more by a lot of Democrats have been pushing it because they see it as the answer for or one way to sort of reduce police and community tensions. But
is there a push here in Santa Fe for that?
Yes.
Including noise cameras.
So this is not a recommendation, but I do just want to say to counselors and others that a lot of the automated, so if it happens, we're not recommending it, but it's really important to put into contract language because these are private companies that sell all of this information to whomever they want, unless we're very restrictive in their use of our information. And so they also sell information to ICE. And so ICE can keep track of people, they sell information to other law enforcement. And so I just wanted to say if that happens, we need to make sure there are a lot of safeguards in there.
Well, it's
But
really
we're not
interesting
recommending.
thinking about technology and the rise in technology and how that puts all of our information at risk. And this is one of those ways. It's just another way for that to happen.
We
Bruce had a
use
question.
cameras at crossings for people that violate the crossing when the train's coming through.
Yeah.
And it was a mess. It was horrendous. Number one, you can't really document who's driving the car. You document
Yep.
the car,
Yep.
not who was driving.
And then
So
you,
who are you gonna give the ticket to?
and this is the issue, then you can have something called an innocent owner affidavit, but then there's all these rules about, well, you can only be an innocent owner once, right? So, you know, and we actually got into this a lot with, well, this is a separate issue, but with asset forfeiture stuff. All the asset forfeiture stuff, and there was a lot of case law both in Albuquerque and Santa Fe around DWI and cars being taken away, but it wasn't, you know, it's like if I went and drove, but it was grandma's car, right? And then grandma's trying to get the car back, but then they said, you're not an innocent owner because you continue to give her the vehicle knowing that she has a problem with alcohol. That's insane. But these are some of the interesting problems that can come up. And I will tell you, Bruce, because since Chicago, I live there too. I love Chicago. Chicago had an automated traffic enforcement program, and they had to pay out. Did you? Well, guess, well, you know what? They probably owe you money because they threw out.
No, so I was in the squad.
But they had to pay back, I mean, billions of dollars in tickets because they found that their system was lacking due process concerns, a whole variety of other issues. They didn't have somebody actually reviewing the tape as well as a number of other problems. So it's, and I can provide some of this, but we're not recommending it. We just put a little note that is not the way to go. And also there were traffic cameras here in Santa Fe for a little while, and then it was defeated because a lot of people were upset with them.
Well, including shooting one.
Yep.
In the middle of the night.
Yes, I remember that.
Shooting.
Somebody shot the camera. He was very, it wasn't me.
Sorry, no.
It wasn't me.
You remember that as
Yes,
a
it was.
man
In the news,
in the middle of
this
the
gentleman.
night in his pajamas.
Yes.
Shot out the window of a speed vehicle.
Right. So, and the other thing is that if we were truly concerned with traffic safety, we would implement a variety of other things, such as road calming. For example, studies have shown that if you put trees in the median or the curvature of a street, people slow down. Speed bumps, which I hate, but that slows people down. Even putting, you know, like the flashing light that says like, you're going too fast and it tells you how much you're going. I know the minute I see that, I'm like, even though I know very well I'm speeding, right? But when I see it flashing in my face, I do. And these are things that actually change behavior, not let's criminalize traffic and let's find other avenues to allow police.
Working.
Yeah, right. It is. Thank you. It is my brain working.
Well, all of us.
Sometimes, yeah.
All of us.
But that, you know, rather than create new mechanisms for search and seizure, which they have plenty of tools for that, we don't need to do that for traffic because it also puts them at risk.
Yeah.
Was this number 20? Is this the last one?
Yes, it sure is.
Yay! So any questions though about anything that came up? Obviously you had a chance to, but if there's anything else we need to fold in here. And just remembering that what we recommended in our last session and some of the minor adjustments we made also will apply to our vote tonight.
I don't know if anyone saw the article last night or the news last night about artificial intelligence and the problems they're having with misidentifying people of color.
People of color.
Yeah. The fun part is that people have been having a hard time without artificial intelligence for, 200 years. So of course AI can't do it either. Lots of problems with our criminal legal system.
This is more about facial
recognition.
Yeah.
It's not like your phone, right?
So are we?
No.
Will we vote on all of them together? And then the report, will we be able to opine or provide suggestions on the report?
Yeah. And when is it going from the city council?
We don't.
The goal is November 29th.
Oh,
Checking us up.
all right.
We have to get that on the schedule for the clerk's office to make sure we have a ample amount of time to present. We have 2 meetings in November. We usually only have 1, and it's always overloaded, but now that we have 2, that might alleviate some last minute stuff. But
And Gabe Sanchez never was able to present for the city council? Or
No.
was he
no, but that's what we need to decide too, is if we want
to incorporate?
to incorporate that and have him there to enhance what our recommendations are, or actually have him present on all findings. I don't know. We need to think about that. How the best way to fold in what was already presented to us and to fold it into the recommendations presentation that we would give to the governing body. So
How long was his presentation? About an hour? 45 minutes, an hour?
Dr. Sanchez's?
Oh,
Yeah.
oh, his, yes. How long would we be allotted during the governing session?
as long as we need, but that's why I was, I mean, I
That's
think
why I'm
we
asking the
shouldn't present
question.
over an
Mhm.
hour because that's a lot. In fact, I think that's a little bit overboard. We'd have to present these and then connect it to the, figure out way to, for Dr. Sanchez to add in, or it's separate. I don't know. We have to think about that.
If he could find a way to condense it, I think the
Mhm.
full context of
Right.
his presentation was very valuable.
Mhm.
There are things that we gleaned from it that were beyond our recommendation,
Right.
but they're contextual.
He's so good at condensing.
Yeah.
You give him parameters and he'll meet them.
Yeah, I think that would be good. We could put the full report in the packet material, and then he can do a condensed presentation on the findings.
How many years were we on this task force?
Was it 3 or 2?
Close to
Well, it's
2.
2.5. I mean,
2.5 years, and we're gonna condense it in less than an hour. Just saying. I think that there needs to be.
well, just to follow up on that, we've given quarterly reports.
Yeah.
And so it's not like we're presenting anything new or strange. We've had consistent quarterly reports that we've given to the governing body that have been accessible to the public. Our meetings have been accessible to the public. And so, yeah, it's not anything new, and it's a culmination of what we've been presenting on. So it won't be, we can summarize like all of the not all of the findings, all of the research and outreach and learning sessions and presentations and community outreach, and summarize that, and then the findings or recommendations will come after that. But we just want to make sure that Dr. Sanchez and his team get also added to that
Because the
presentation.
city paid for that.
That's right.
Just another reason that,
So,
as opposed to all of our volunteer hours.
exactly.
A lot of hours.
Yes, it is. If we should calculate those.
Oh, my God.
No,
that extra work we did.
I think that's a
Which
really
we all
good idea.
did.
I mean, it won't calculate all the time, like beyond our regular meetings. It's like
Right.
things that we worked on, things that.
In the community,
In the
doing
community.
those focus groups, all of that.
Yeah, that's true. It's not even counting, like these meetings don't even count all the work that we had to do to put together the focus.
Right.
Yeah.
And
Yes.
based on the length of it, the mayor may want to do a special meeting. I mean, a presentation that goes over an hour when we're already there past midnight sometimes.
Yeah.
The attention
Yeah, I
span
think
is gone.
If the
Yeah.
attention span is,
We could do a special meeting or try to fit that
Yeah.
in.
And let's remember that
The only thing
it's time to vote for our city council.
Yeah, I know. I was like, which thing it's time to vote?
It is.
It is. Okay, can I just say, we should add our hours. I feel like someone should know, like, we can estimate. Because it was all those focus groups, it was all of our meetings, I just feel like they should know, really.
The time that we invested
Yeah.
in this work.
I've been tracking the hours, not just of the bi-monthly meetings that we have, but also the working sessions that each of the subcommittees have, and I'm sure there's more on your end that I don't even know about. And I know with Dr. Sanchez, he's probably tracked because they have to do that in their internal stuff. So we could get that number. I'm happy to work on that. Happy to work on that. Okay. So we've got 22,000 things. Oh,
did you have a question before we vote?
No, the only thing the reason I was asking the length was not either. I would highly recommend when you approach the clerk that there not be other presentations that evening. Because they tend to stack presentations that they think will be 15 minutes each that are an hour each.
Right. Oh yeah, we will make sure this. So that's the alternative. And what about a special meeting? But just know that that's kind of harder to do with council scheduling. A little messy,
especially in
our schedules too. So
I feel like we did a quick one for MDS.
We did,
and
it was good.
Yeah, and so we had a report that they could read. Who knows if they did? I don't know. Did you? And then we had the PowerPoint that did it, and then we just went quickly through it.
Yeah, and I can share that PowerPoint as a helpful template.
Did you hear that? The template that they used? Okay. All right, you're in charge here. So.
Yeah, this all depends how we want to incorporate Dr. Sanchez into the meeting. If we want the whole presentation, that's gonna take a lot of time. But Renee and I will work with the clerk and try to figure out the best time to do it.
And I agree with you, like to show the breadth and depth of our work does require or should allow for a special meeting, but I think when we start getting closer to the holidays, it starts really getting hard to schedule things.
So let's entertain a motion before we wrap up here for the approval of the task force final recommendation.
For all working groups?
For the whole task force.
Sorry.
For everything.
I motion that we approve all the recommendations that were discussed in their amended form.
A second.
Motion a second. Any further discussion? We have a roll call vote, please.
Absolutely. Roll call. Councilwoman Renee Villarreal.
Yes!
Monica.
Yes.
Yes. Councilor Chris Rivera.
Yes.
Mary Lewis.
Yes.
Romero, Bruce, Singer.
Yeah.
Okay. Marcela Diaz. Yes. Emily Cotton. Gino Zamora.
Yes.
Thank you very much for honoring member.
You gotta take a picture of this amazing.
Yes, right.
You gotta take a picture.
Any final matters from the task force? Nope.
Motion to approve.
Right.
September, please.
Thank you for reminding me. We have a motion to approve
Meeting minutes.
I think we have. We're not meeting again.
That's true. Okay,
We want to.
just in case, right?
Approval for the final meeting minutes.
A motion to approve the final meeting minutes. Right? Is that what you need?
Yeah, do we have a second?
I second.
We have a motion and a second. Any further discussion? We have another roll call vote, please, Valeria.
Absolutely. Councilwoman Renee Villarreal.
Yes.
Gino Zamora.
Yes.
Emily Cottonbach.
Yes.
Marcela Diaz. Yes. Bruce Singer.
Yes.
Mary Louise Romero.
Here, yes.
Councilor Chris Rivera.
Yes.
Monica. Oh.
Yes.
All right, we are adjourned.
You guys
Thank
need to
all.
get some classes.
We got it.
Windows on
We
your
got-